Webinar, we're going to cover the new regulations that were announced yesterday and will come into effect this Thursday, October 1st, for personal services, meaning barber shops, hair salons, nail salons, massage establishments, places like that. So a little bit of housekeeping before we get started. Again, I am with the Department of Business Affairs and Consumer Protection. We are the department that enforces the Phase 4 reopening guidelines. If you have any questions over the course of this webinar, please submit them via the chat function, which you will find on either the top or bottom bar on your webinar. So again, submit any questions you have to the chat function. I see some of them are already coming in. I promise I will get to those questions. And I will either answer your questions over the course of the webinar, or I will make time at the end in order to answer those questions. So again, thank you for them. I see a couple coming in that I will cover over the course of the webinar. If I am unable to answer your question, or if I do not answer your question, please do not hesitate to follow up via email at bacpoutreach@cityofchicago.org. You can find that email address on the bottom of every one of these slides. I also just typed it into the chat, so you can copy and paste that into your email. There may be a question that I need to consult with some of my colleagues on, or maybe something that I don't get to just in our brief amount of time here. So please don't hesitate to send an email to that email, and I will follow up. Additionally, this webinar is being recorded, and it will be posted on our website at chicago.gov/businesseducation. I also want to point everybody to where you can find all of the guidelines which can be found at regarding reopening, which can be found at chicago.gov/reopening. So everything that I'm covering today can be found on that reopening website. It's also where any updates to the guidelines will be as they may change into the future. I think I covered all the housekeeping, so I'll get started on this webinar. Again, today is all about the new regulations for personal services. As I'm sure you've heard, this is why you are here. Yesterday, the mayor, along with Health Commissioner Dr. Arwady, announced the next step in our Phase 4 gradually resume reopening framework. So we have made significant enough progress over the last few months, particularly the last month, that we are able to ease certain guidelines as a part of Phase 4. So today I'm going to I'll give a brief overview of all those guidelines, then I'll specifically talk about personal services, and I'll also provide an overview of everything that has been in place for personal services. But I'm going to start with a little bit of an update on the data. Because before we get into this, it's important to remember that everything we do, all of these decisions are based on the data and based on what we are seeing. So one of the main things we're looking at is case rate. And as you may know, as I'm sure you know as personal services, that back in mid-July, we saw cases were starting to rise, we re-implemented certain restrictions. The reason why we are now able to start easing those restrictions is because, as you can see, dating back to about the end of August, we have seen cases going down. Now, we're not at our 200 cases per day goal, but we are doing significantly better than we were back in August. So our goal is always we have a number of different metrics that I'm going to cover. And we looked at all these different health metrics we want to see that they're getting better over the course of 28 days, over 4 weeks, in order to know that we are able to make this movement. So while we're not at a 200 cases per day goal, we have seen significant progress. Our peak was 358 new cases per day. Now we're down to about 299. So we're able to move forward because we've been stable or decreasing for more than 28 days. We have also seen hospitalizations go down significantly. They've been stable or decreasing since August 27th. We have about 14 new hospitalizations per day. Very importantly, and this is something that has been very good for a while now, we have seen a consistently stable or declining number of deaths each day dating back to June. That's great news. It means we're having significantly fewer severe outcomes from COVID-19. Emergency department visits for COVID-19 or really any COVID-like illnesses have also dropped off pretty steeply, as you can see, especially in the last 2 or 3 weeks or so. We're at about 45 emergency department visits per day, compared to about 80 in the middle of August. Positivity rate is down below that 5% threshold. That's our target, 5% positivity. We've been under that, stable or decreasing, for 14 to 28 days. So we're now at about 4.3% positive. Next, very important, our hospital capacity has been truly adequate and for a very long time, dating back to May. Now, this is an important metric to make sure that we can handle any sort of rise in cases. As you can see, hospitals, both non-ICU beds and ICU beds, and ventilator use is very much below our goal, meaning, again, that we're able to move forward. Testing capacity, this is very, very important. Our goal is over 4,500, and we are pretty consistently, as you can see, over that number. We had a little dip around Labor Day, but other than that, we've been in 8,000 range, which is great news. So what does all this mean? We've had, again, I just want to, before I get into the specifics of the regulations, make it abundantly clear that we are making these changes because of the data. We added restrictions back a couple months ago because of the data, because of the health of our community and what the data tells us about that. And now we are able to ease these restrictions because we've made progress. And if we make more progress, we can ease more restrictions. So today I'm specifically talking about personal services, which really applies to number 1 and number 5 here. But I am going to provide an overview quickly of all of the new regulations. First, capacity, indoor capacity is increasing from 25% to 40%, maintaining our maximum of 50 people in a room or space. This applies to any establishment, including personal services, that have been limited to 25%. So if your number was 25%, your number is now 40%. This is the case for gyms, restaurants, churches, event venues, museums, movie theaters, et cetera, et cetera. Any place that was at 25% is now at 40%. And again, this includes personal services. Next, this does not apply to folks on the call, but we are reopening taverns. Breweries, taverns, bars, any place that serves alcohol without a food license can now be open at 25% or 50 people, whichever is fewer. Again, doesn't apply to folks in their business here unless they're the ones going out to bars and restaurants. But bars and restaurants can now serve and sell alcohol until 1 a.m. and can remain open until 1:30. Maximum group size for health and fitness classes and after-school programming will increase from 10 to 15 people. Again, this does not specifically affect personal services. These are for your spin classes, after-school classes, anything like that is now a maximum of 15 people. And then finally, most relevant for folks on this call, facials, shaves, and other personal services that require the removal of face coverings will now be allowed. So I'm going to talk today in detail about all of the guidelines for personal services and highlight specifically the ones that have changed. Let me reiterate, these changes will now come into effect on Thursday, October 1st, this Thursday. When I say personal services, I mean beauty salons, nail salons, tanning salons, day spas, massage establishments, saunas, hairstylists, barbershops, ear piercing services, tattoo parlors, really any time a personal service is being provided with kind of the one-on-one with the customer. So again, key changes effective Thursday, October 1st. I'm going to talk about all of these, especially the ones in red, in detail. Other than these ones in red, though, everything else is remaining the same. So if you had a guideline you have been following and it's not specifically mentioned, it will still be the case. Ensure ensure greater than 6 feet of social distancing between workstations. If you're a hair salon, barbershop, make sure your workstations are at least 6 feet apart. And if they're not, you should be using impermeable barriers. We also encourage the use of impermeable barriers anytime, any place where social distancing is not possible, such as checkout counters. Next, limit gathering size to ensure social distancing to 40% capacity. Again, 40% capacity. It was 25. If you have anytime you have a gathering or a choke point, you should have no more than 50 individuals and no more than 50 individuals in your entire space, which hopefully should not be the case. It is not the case for the vast majority of you anyway. So capacity is limited to 40%. Hopefully by now, you all know how to calculate your capacity because you have been operating at 25%. Our general recommendation, if you have any kind of specific mathematical questions on how to calculate your capacity, please don't hesitate to reach out via email or to send a question via chat. But hopefully you know how to calculate your capacity. It was at 25%, now it's at 40%. Protective gear must be worn by employees and customers. Face coverings over the nose and mouth. And here's our new change. Personal services that require the removal of face coverings are allowed. We recommend limiting these to 15 minutes. Again, let me reiterate the wording there. We recommend limiting these services to 15 minutes. That is our recommendation. But they can be allowed. This is stuff that has not been allowed over the last couple of months. They will now be allowed starting this Thursday, October 1st. Make sure to be providing hand sanitizer for customer use and ensure that employees wash hands before and after every service. There's a new formal guideline in place that all places of business should be providing hand sanitizer upon entry. The vast majority of you are already doing this. It's now more formally in place as one of our guidelines. Any products you are using should be sanitized after every customer, and please eliminate the usage of samples and testers. Prior to each new phase, if possible, we recommend providing training to refresh proper hygiene, disinfection, and sanitation practices. I've seen a couple questions come into this. Let me just recommend, again, we are recommending limiting these services to 15 minutes. And you can do more, but we recommend limiting it to 15 minutes. Nothing here on this slide has changed. I do just want to remind people of the guidelines that are in place for personal services. Prior to entering establishment, your employees should be self-screening to ensure that they do not have symptoms of COVID-19, and they should not be reporting to or staying at work if they exhibit symptoms or feel ill. That's at minimum. We also do recommend that you do some sort of temperature check, something like that. But at minimum, folks should be self-screening. Nothing's changed here. And I also want to remind people that everybody should be staying home when they are sick, whether it's COVID or not, especially if they're COVID-related symptoms. If you have a pending test, you absolutely should and are legally required to. We have a health order in place, required to stay home if sick. Hopefully all of this is standard by now, but you should be establishing daily cleaning standards for spaces and high-touch items, sanitizing high-touch surfaces, disinfecting and sanitizing all equipment. If you have self-serve food or drink stations, they can be open, but the employee must be served. You need an employee to be serving the food or drink, and they must be wearing PPE. Quick point about food. If you have any food or drink, then you really should be following the food service and bars guidelines, which means everyone should be seated while they are eating or drinking. You must maintain 6 feet of social distancing between the people that are eating or drinking and any other customers or any staff. So I saw a question come in if someone could be eating or drinking during services. A couple points on that. you should not be eating or drinking during services for a couple of different reasons. First of all, masks should only be removed during services that require them. Just because I'm now saying masks can be removed during facials or shaves, they should not be removed during a haircut. They should not be removed at a nail salon. Any place, the only time masks should be removed while a service is going on is if a facial or a shave or something like that that requires them to be removed is being conducted. So you need to remove a mask in order to eat or drink. Therefore, you should not be eating or drinking during services. Additionally, under the food service and bars guidelines, whenever you are eating or drinking, you can only have the mask removed when you are at least 6 feet away from the other customers and from staff. So while a service is going on, you are inherently not 6 feet away from staff. So you can have food or drink stations open. You can have people eating or drinking, but you must follow the food service and bars guidelines. So someone could be eating or drinking while they are waiting, as provided that they are seated and 6 feet apart, but they cannot be doing it while the service is going on. So our questions are temperature checks on the wrist an option? Yes. Again, we encourage folks to do temperature checks, but it's not a formal requirement. You should be providing guidance for hygiene standards. You should be having guidelines and criteria for entering, face coverings, things like that. If possible, increase airflow indoors according to the CDC guidelines. You should be minimizing in-person interactions wherever possible. Obviously, personal services require people to be there in person, but anytime you can do online training, virtual staff meetings, things like that, we strongly recommend them. We encourage contactless payment, self-serve checkout where available. Should be minimizing client overlap. That means one client per employee with no scheduled overlap. Walk-ins are allowed, and they can wait for appointments in the establishment if they are social distancing. We still do strongly recommend reservations in order to keep congregating to the minimum. Should also be limiting staff travel across multiple locations. Finally, then this is important, you should be following the health department and CDC guidance for testing and tracing protocols. If someone does contract COVID-19, they must follow all CDC guidelines before returning to work. And the work should be cleaned and disinfected according to the CDC guidelines. Anyone who's had close contact with somebody with COVID-19 should quarantine for 2 weeks. Additionally, you are encouraged to notify the health department if you are aware of 2 or more cases possibly associated with an establishment. Finally, you should be keeping a log of name, contact information, and service provided for at least 60 days following the service. Great, so that's an overview of the personal services guidelines. I want to remind everyone that BACP has been and will continue to enforce these guidelines. We've conducted over 2,000 investigations since phase 3 began back in June, and we've cited over 140 businesses, which is a lot, but also, let me be clear, that means the vast majority of businesses are following the guidelines, and we thank all of you for that. But please be mindful of these new guidelines. Again, just because we are allowing face coverings to be removed for certain specific services, they should absolutely, critically, still be worn at all other times. Also, employees, again, should always be wearing face coverings, especially when they are performing a service that requires face coverings to be removed by the customer. So while we are reopening slightly and making some changes to your guidelines, this is the time more than ever to be doubling down on your compliance with these guidelines. It is critical that we continue to do the right thing. And I just want to emphasize that businesses have been doing a great job. This is only a 6% violation rate, and most of these are in response to complaints. We just did proactive, if we did more proactive canvassing, we would have even lower, even better non-compliance rate. So I want to thank you all. I know it's been an incredibly challenging summer want to thank you all for your ongoing diligence and dedication to following these guidelines. Please let us know if you have any questions. And here's additional webinars that will be taking place. At this point, great question just came through. Additional locations, steam rooms, saunas, hot tubs, nothing has changed on that. They should still continue to be remain closed. Now, if you do have any location, so pools are allowed to be open. So if you have an establishment that does have a larger pool space that you would consider more of a pool, that's something that can be open, but sort of those auxiliary experiences should not be. Great. So again, this webinar is being recorded. If you are interested in any other additional webinars, please check out this list right here. I'm going to be doing a health and fitness center webinar in just a little bit, but I'll stay on for a little bit to see if anyone has any questions. Otherwise, please email us, bacpoutreach@cityofchicago.org. Thank you.